Hello everyone. Today we'll be discussing about the diabetes mellitus, its problem statement globally, about its prevalence, its incidence, and other related data. Let's see the definition about the diabetes mellitus. So in 1997, American Diabetes Association has given definition of diabetes. So as per this definition, diabetes is a group of metabolic disorders which is characterized by hyperglycemia, and this hyperglycemia is resulting due to defect in insulin secretion, or it can be due to insulin action. However, insulin secretion is normal, or it can be of combination of both this condition. Later on, this definition was accepted by international bodies like World Health Organization. Later on, there were evolution in the definition of diabetes, and this definition is based on the etiology, pathogenesis, biochemical features, and implication of diabetes. And this definition we can say one of the complete definition of the diabetes mellitus. So as per this definition, diabetes mellitus is a metabolic cum vascular disorder, and this is because of the multiple etiology, not by a single cause, and ultimately this causes chronic hyperglycemia, and also there are disturbance in the metabolism of basic fuel of the body, that are carbohydrate, fat, and protein metabolism. And all these defects are resulting either due to defect in the insulin secretion, or defect in the insulin action, or can be of combination of both. And ultimately this chronic hyperglycemia is causing changes in the blood vessels, both in small as well as in large blood vessels. If defect in a small blood vessel is there, it is known as microangiopathy, and defect in the large blood vessels is known as macroangiopathy. Diabetes is a seventh leading cause of death globally. Diabetes is one of the major cause of blindness, kidney failure, heart attacks, stroke, and lower limbs amputation in the world. Diabetes is a chronic disease, as we have already studied that either it can be because of no insulin production, or insulin production is there but insulin produced cannot be used effectively in the body, or it can be due to the combination of both these conditions. It has been seen that risk of cardiovascular diseases in a patient of diabetes is 2 to 4 times higher as compared to the normal general population. When we see the type 1 diabetes mellitus versus type 2 diabetes mellitus, the prevalence of type 1 diabetes mellitus is around 5 to 10%. However, the rest 90 to 95% of the cases are of type 2 diabetes mellitus. It means the prevalence rate of type 2 diabetes mellitus in general population is much higher as compared to type 1 diabetes mellitus. When we compare the urban population with rural population in respect of diabetes prevalence, so in urban population the prevalence of diabetes is approx 15 to 20%. However, in rural population it is just half of the urban population, means it is approx 7 to 10%. Let's see the prevalence of diabetes in the world. So in the world, China is the country which is having highest number of person with diabetes, and it's 140.8 million of Chinese population is having diabetes. However, in India is the second highest country, having the second highest number of diabetic patients, and approx it's 74.1 million of population is having diabetes mellitus. This is the list of top 5 countries in respect of number of people with diabetes. So as we have already studied that China is on top position, followed by India on second position in respect of number of people with diabetes. Pakistan comes third, and United States on fourth position, and Indonesia is on fifth position in respect of number of people with diabetes. When we see the incidence of diabetes, presently approx 537 million of adults which are of 20 to 79 years of age group in the world are having diabetes. It means almost 1 out of 10 person is having diabetes mellitus. However, this number is predicted to be increased by 643 million by 2030, and this number will increase up to 783 million by the year 2045. And it is also predicted that 541 million of adults, they are having impaired glucose tolerance, means they are more prone to develop diabetes mellitus. However, they are presently not having diabetes. It is also noted that in the year 2021, approx 6.7 million of people, approx 67 lakhs of people, they died either due to direct or indirect causes of diabetes. Let's see some other data with respect to diabetes. So almost 1 in 2, it means approx 50% of the population, they are actually having diabetes, but they are undiagnosed. Out of 6 live births, 1 live birth is affected with the diabetes during the pregnancy. Approx 1.2 million of population of children and adolescents who are of age group 0 to 19 years, they are living with type 1 diabetes in the world. It is also seen that 3% out of 4 adults, they are having diabetes, they belong to the low and middle income countries. It means in low and middle income countries, the prevalence rate is increasing. When we compare the countries of high income with low income countries, so prevalence of diabetes in high income countries is 11.1%, and countries with low income, they are prevalent with 5.5% of diabetic patients. But the main concern is that there will be rapid increase in prevalence of diabetes in middle income countries, and it is expected that approximately 21.1% of population of middle income countries will have diagnosed with diabetes mellitus. It is also noted that the health expenditure on diabetes will be expected to be increased by 1 trillion by year 2030, and it has seen that in last 15 years the health expenditure on diabetes has been increased approximately 316%, which is very high. So what are the causes of increasing prevalence of diabetes in India? So it has been noted that in last 1 or 2 decades there is rapid socio-economic development in India. Also there is rapid demographic changes in India as well. It is also found that in India there is low level of awareness about diabetes. Also India has less trained medical and paramedical staff who are not as much trained in non-communicable disease diagnosis and management, including the diabetes. Also the cost of medical service and medication in respect of non-communicable disease in India is higher. We have come to the end of this part. Thanks for watching this video. Please like and share this video with others. Thank you.